In today's Spotlight interview, I have here Dr. David Cowhig, holistic dentist and founder of DentalWellness. David is a pioneer in holistic metal-free dentistry and aesthetics, providing scientific-based biological dentistry. He supports his patients as an individual and takes into account the variety of factors that can lead to dental and oral health problems. So welcome, David, and thank you for taking your time to be here on this episode.
Hello, Bojan. Thank you for inviting me.
Yeah, so great. Then let's dive straight into our first topic. David, your clinic is well known for 100% metal-free solutions, and especially zirconia implants. So tell us a bit why and when did you start looking into this new way of dentistry?
Yeah, sure. Look, I've been qualified for since 1989 as a dentist. I trained at King's in London, and obviously trained in a traditional manner. And for the first few years, I wanted to expand my knowledge. So I looked into dental implants, and actually in 1995, spent the year learning all the aspects of titanium implants and actually placing my first titanium implants. At that time, there was no alternative. And the design of the titanium implant, which has been around now for about 50 years, hasn't really changed a lot in that time. Now, I obviously was practicing, and I was practicing in a practice that was holistically minded. So we were very aware that even 25 years ago, that having multiple different metals in the mouth wasn't ideal. So I had decided that if I was placing any titanium implants, then it's important that there was no other metals in the mouth. So obviously that may involve a safe removal of mercury, silver amalgam fillings, and also other metals, whether it be gold or metal framework dentures. We just try to create a metal-free environment apart from this one aspect. If there was a gap in your smile, or if there was a tooth missing or a couple of teeth missing, then the placement of a titanium implant would be at the bone level under the gum, and then we would restore from that implant upwards to give you new teeth, all in a ceramic material. So that was the real, my parameters were very narrow as far as for the patients that I could see that place implants. Most dentists would place titanium implants wherever there was a space without looking at what else is in the mouth. When I came to Australia 20 years ago, or 24 years ago, no, sorry, 20 years ago, I set up my own practice in the city, in Brisbane City, called Queensland Holistic Dental, because I had been, had my eyes open to the concept of whole body health and oral health and how much they were linked. So I also had the opportunity to do a fellowship in nutritional and environmental medicine in 1998. So again, quite a long time ago. And that just influenced me in how I took the practice forward, so that we've been a holistic practice now for over 20 years. The last 10 years we've been working in the Gap, and it was rebranded as DentalWellness. But around 11 years ago, I became exposed to the concept of zirconia, of a ceramic implant. And this intrigued me. Obviously, this was the one missing part of dentistry that I hadn't achieved a metal-free option. So I went to New Zealand, where one of the German dentists who had set up the system in Switzerland and Germany had moved over to Australasia. So then I learned in 2007 and got accredited with a system placing ceramic implants. So from then on, really, the majority of my work is working with ceramic implants. I haven't placed a titanium implant for over 7 years. And now our practice is really a total metal-free solution. So it just, the benefits of ceramic for me, for my patients, is one, they work, they integrate with the body as well as titanium implants. They're not a metal, so they don't have any metal charge, so they don't attract bacteria. So unfortunately with titanium implants, there is often an inflammatory process, an inflammation, a bit like gum disease, but it's specific to implants. It's called Peri-Implantitis. And it's been shown to be a reaction. The body is reacting potentially to titanium ions that are releasing, creating a bit of an autoimmune reaction. Now, with the zirconia, because it doesn't have a metal, it doesn't have this reaction. So the soft tissues really love these implants. The bone really likes them. It does rely a lot on the health of the patient, more so than probably what is taken into account in titanium. So we're always looking at the importance of the vitamin D3 levels with the patients, their diet, their general health, as far as having a low inflammatory system. Because if you have a high inflammatory system and low and poor bone metabolism, then there's a chance that you're going to get a problem with any implants. But with the zirconia implants, they're more of a biological solution. So we emphasize the fact that it's important to optimize these issues as much as possible, not just before the implant, but from then onwards, and continue towards optimal health, which is obviously our goal with our dental health. So, so over the last 10 years, we've been placing different types of ceramic implant, mainly with one system called Z Systems, which is a Swiss-German system. And they have developed from having a simple one-piece implant to a whole combination of different styles of implant now, where for every situation with titanium implants, there's now an alternative zirconia metal-free option. So the benefits titanium implants had was you could actually bury a titanium implant, leave it for 4 to 6 months, and then re-expose it, so you know that that implant is not going to be stressed in the mouth for that period while it's healing. Whereas with the one-piece ceramic implant, you couldn't do that. You had something that was emerging from the gum straight away, and if that wasn't looked after very, very carefully, then you would get problems with the integration. So now the Z Systems implants have introduced, or they've had for a number of years, a two-piece system. So again, a system where you place an implant under the gum or just emerging through the gum, and then leave it to heal. So then 6 months later, we're able to restore it with a strong, beautiful ceramic crown or bridge or whatever's indicated, really. So my practice has had a focus on all aspects of dental health, the priority of getting good gum health, the priority of good function of the jaw without any pain and headaches. And sometimes when there's a tooth missing, or you've had a tooth taken out, or you're going to have a tooth taken out, if you've got a root canal treated tooth that maybe is potentially infected and is challenging your health, then you need a good solution to actually be able to replace that. And now we've got an option where we can replace that, allow the bone to heal healthily so that your whole body health improves, and then place a zirconia implant in the healed bone and get a good solution again, so that you can get that function of your jaw back, which is very important, because if you have poor jaw function, then that can lead to headaches and neck pain and acceleration of damage to the rest of your teeth as well. So it's very important that that aspect is taken into account. And again, with the zirconia implants now, we're able to achieve that.
David, can I ask you, what is zirconia made of? You mentioned it's very biocompatible and so on. What is the special aspect of it?
It is a bioceramic which is made. It's called a zirconia dioxide, which the actual there's some contention about. Zirconia is a metal, but it actually is a ceramic. Zirconium is a metal with an M on the end, and when that combines with oxygen, it is an oxide, and it's a ceramic. So it's 100% bioceramic. So it doesn't have any. It's purely white. It doesn't have any charge. It's very, very strong, and the body doesn't react against it. So
it stays always white. It's not. Is it changing?
It stays always white. Yes. So if you have tissues that recede around an implant, then often with titanium you may see the darkness of the metal showing through. So you get this dark neck, not only in the gum but in the tooth itself. With zirconia, it will always be white. So the ceramics that we can restore over the zirconia implants look exactly like real teeth. They're just a beautiful replication. So there's nothing fake.
Yeah, many people might think that titanium is stronger and more durable than zirconia. What can you say about this?
Well, look, the strength of zirconia is in some aspects actually stronger than titanium. There is some question, again, another contention that zirconia fractures. Now, in the 10 years that I've been placing them, I've never seen any fractures. I've never seen any suggestion of a fracture. So I can't really, if you have a ceramic crown on top of a tooth, then that can break just like any other ceramic material, but I've not seen any ceramic implant fracture at all.
That's impressive. Yeah, that's amazing. Because there's a bit of discussion what is really better, titanium or zirconia, and as far I know, there are not so many dentists placing zirconia implants or in general ceramic implants. And you were one of the first, basically a pioneer in this field. This is really. Is it still a new field, or is it simply a different way of practicing?
Look, it is a very new field, and I think it was just the fact that I had learned how to place titanium implants, and most holistic dentists who take on the holistic philosophies haven't gone down that route of taking getting that training. So I was fortunate in the fact that the zirconia implants tied in with my philosophy very quickly. So over the last 2 or 3 years, a lot of practices are starting to introduce zirconia implants. The 2 biggest implant companies, Straumann and Noble Biocare, have both got their own individual ceramic implants. So they know that this is the way of the future, really. And they're actually working with, one of the companies is working with the Z Systems company for their 2-piece implant system, which isn't a very exciting change. It's exciting that the big companies are actually becoming involved in this field. So yes, I've been the only ceramic implant dentist probably in Australasia for the last 10 years. And now there are some more practices that are doing some training, and there's more companies coming to Australia, encouraging dentists to take them on board.
Is there also more awareness because people getting more sensitive, for example, sensitive to electromagnetic pollution or sensitive to certain food and to their environment? And is this also a factor that dentists have to change the way of practicing? because the demand is
Absolutely. Absolutely. It is something that most dentists really struggle with, the concept that anything in the mouth can have an effect on the health, and the effects of EMFs and metal charge. It's not something that's really promoted in the education, but you can actually measure some of these electrical charges in the mouth, especially with mercury amalgam. And in the protocol of removing amalgam, there's often a way of actually finding out which is the highest charge first to remove safely first. So we're slowly removing those, not only the mercury, but also the charged particles or the charged bodies in the antennas in your mouth, really. So yeah, more and more people are being aware of that. Obviously, it's becoming the issues with EMF sensitivity is becoming more and more a big problem as technology improves and we all demand Wi-Fi all around us. It's something that can't be ignored anymore. So this again, people.
Yeah, sorry. How would you explain that the EMF sensitivity increases with having metals in the mouth? It's probably not very obvious for most people.
No, look, again, it's really, I mean, there are some people who are very sensitive, but the people who come to visit holistic dentists really have no thought of wanting metal in their mouth, in any part of their body. So, and there wasn't an opportunity, there wasn't an alternative before, but now there is an alternative. So that's where, when they've done studies on what would people prefer, a metal or a non-metal in the body, and the majority say they would prefer a non-metal.
Interesting. Yeah. So there's also a growing awareness, and I know you're educating your patients, which I really appreciate. You're educating people who are not yet your patients, because you believe in your mission and you believe that the body has to be seen as a whole. So it's really unique, I would say, in any kind of service or health service-based business. And you talk a lot about the different health aspects of, or difference between titanium implants and zirconia implants. There are probably far more of. We mentioned only a few of them. So are patients asking you before are they asking you what you would recommend them, or are they very clear when they come to you? Yes, I want a zirconia implant. That's
Look, the majority of them aren't. The majority of patients really are concerned with often a root-filled tooth that's been causing them problems, and the suggestion of having that removed, and then what are the alternatives? What can I put in its space? And then the discussion of potential, either a bridge, which can involve damage the teeth on either side of where the space is, where that tooth is going to be missing. And sometimes those teeth either side may have compromised situations as well. So the risk that they will cause problems in the future. So they're a bit of a dilemma, because most general public don't know about ceramic implants at all. So they're coming to ask for a solution to fill the space, to make them have a smile where they're confident, smiling without any metals in the mouth. And that's where the discussion and the explanation on the benefits of the zirconia implants and what's indicated for them to be successful, really. So I'd say the majority of my patients, they know that they need some teeth taken out. They've been to dentists who have suggested titanium implants, and then they've come to me looking for a solution and looking for a way of, again, removing, if need be, that root-filled tooth in a safe way so that the bone can be healed in a healthy way, so that then it would be suitable for a zirconia implant as well. So the removal of the tooth is a very specific way so that that bone heals properly. So, I mean, that's the majority. Some people, obviously, they come and they've researched zirconia implants. They've got some questions about it and they want to discuss it and then decide from there. We're fortunate we have a 3D cone beam X-ray machine in the practice, which gives a 3D picture of the whole of your jaw and your sinuses. So we can see three-dimensionally how much bone you've got in the area where potentially either we're placing an implant, or if there's an infection, how bad is that infection in the root fill tooth? And it gives a three-dimension clear view of where the problems are that need to be addressed first. So people coming often inquiring about zirconia implants, thinking they've only got one problem with a tooth. When we do the scan, unfortunately, sometimes it shows up that there's 2 or 3 different problems, but that patient didn't realize that they could be affecting their health as well. So it often then throws the question, well, what am I going to do? What are my options? And that's where a pinpoint surgical guided zirconia implant is the long-term solution, which is an exciting way for the patient to say, okay, well, I have got options now. I don't need to go down the option of a denture or the risks with a bridge. And it may have an impact on my health, which is what we're striving for.
Yeah, you mentioned shortly that zirconia is white, it stays white, and
yeah.
Not many people know that you're also practicing aesthetic dentistry. And tell me a little bit, why is it so important having this white implants and not a dark titanium implant? What's the difference in aesthetics?
Well, look, I've got these two models here.
Yeah.
One is a simulation. They're very big models. They're 8 times bigger than what would normally be. But a metal implant is a sort of a gray metal material. And when that's placed in the tissues, if it's placed in your mouth and then your soft tissues recede a little bit, then you're going to see the neck of the implant as a gray neck. With a zirconia implant, when that gum recedes, if it does recede, which it generally doesn't recede around the zirconia implants, you'll find that there's still a white background. So even if that is exposed, it will never show that it's a big problem. So your smile will never be compromised. The other benefit is if you have metal, then a laboratory has to mask that metal with a ceramic. So that often involves using another metal that will actually be placed over that metal and then porcelain bonded over the top. So you end up having these combination of different metals. With the zirconia, you have a white solid background, but then the technician can work from that to get the most aesthetic result. So if you're doing any work in the anterior, in the smile region, you want something to last a long time. You want it to look completely natural for the long time, and you want the gum health to be healthy around it as well. So these are all reasons why the zirconia implants are so attractive and get such a wonderful response.
Wow, that's interesting. How, in terms of procedure, if somebody comes to you with a missing tooth, with a gap, then obviously you place this implant. How is this going from there? How many months does this take to heal, and when can you put on the final crown? How is this time-wise working?
Look, that's a good question, because people often we want it now in this society. So the benefits, say for example, if you had a front tooth that was infected and there was a crown on it and you wanted that tooth taken out, well, the solution with this specific zirconia implant, it's actually designed so that it can be used as an immediate implant. So that tooth could be taken out as long as there's not if there's a lot of chronic infection, then we would probably wait, take the tooth out, remove all of the infection, allow the healing process to occur, and then 8 weeks later, you would then place a zirconia implant. So we would make something as a temporary measure to last for 8 weeks while that process is being done. But in a case where the tooth has split or the tooth needs to come out, but there isn't a lot of chronic infection, then that tooth can be taken out, any infection removed, and this can be put in straight away. So as an immediate implant with then a temporary crown over the top, exactly the same shape as the tooth that was there on your natural tooth or on your crown tooth. So you walk out of this practice with a front tooth still, with a zirconia implant, and then 4 to 6 months later, you come back and we replace that temporary crown with a long-term crown. So you're looking, again, if that needs a lot of work, that might take 2 visits. So you're looking at an appointment for the removal and placement of the implant, and then 6 months later, either one appointment to fix it in 1 visit, or if it's the aesthetics needs to a lot of work, then we would use a laboratory that would have a 3-week gap. So we would take that temporary crown off, prepare it perfectly, take an impression, send that to the laboratory, put another temporary crown on. 3 weeks later, you return and we put the beautiful crown on. So it isn't a lot of inconvenience in the end. It's spread out over a long period of time. So if you are having a molar tooth removed, or one of the side teeth or the back teeth, then if the side teeth, depending on how forceful your bite is, you could use this immediate implant in that situation, or you could decide to place an implant which is placed just into the jaw and it just emerges from the gum, and then you either have a space or we make something temporary for 6 months. Then after 6 months, we then take a little cap off that implant and we bond what's called an abutment into the implant, and then we're able to put a crown on the tooth. So then you get your full tooth back. So that allows those areas which are under a lot of stress to heal without any stresses on the implant. So the further back you go, the more likely it is that you're not going to get a crack. You're not going to walk out straight away with a tooth there. You're going to have a period of healing and have it so it's de-stressed for 4 to 6 months, and then we're able to put a crown on. So it's slightly different in each situation. But in this front region, there's now a solution, which is more than what most patients are worried about with their smile. There's a solution that does not inconvenience them with a big gap or having to wear a denture for a long time.
Yeah, that's important. Yes, yes. Yeah. What would you say if I would be in the situation that I need to take a decision what kind of implant I choose? What are the main points so to make it really easier for people who are not so knowledgeable about these two options?
Look, I think your health is number one. I think, if you are prone to autoimmune reactions, autoimmune diseases, then you have to be very, very careful with what you put in your body. And most people who have those conditions are very aware of that. So in that, I wouldn't be suggesting placing a metal in the body. In some cases, if a zirconia implant isn't an option as well, then the option of some sort of bonded dentistry, so it doesn't damage the teeth either side. There are ways of making solutions that don't involve damage to a lot of the teeth in a particular area. So the things that your health is number one, the position of the implant and your bite if you've got a really, really heavy bite and you know that you're a clencher and you're used to having teeth breaking, then if you're having zirconia implants, you have to be prepared to be a little bit more patient, because we will give the implant more time to integrate before we start loading it, because you don't want an implant to fail. So that would be another thing. Your sleep, again, your sleep is very, very important. If you have broken sleep and you wake up with headaches and neck pain, and you've got a broken tooth, and this is often the case, somebody who's clenching and their tooth is split, then if that sleep and the way that they bite together isn't addressed at the same time, then I would be leaning away from having an implant, because the risks of failure are higher in that sort of situation. So it's not just a matter of the biology, it's a matter of the physical forces going through these areas, which are linked to your breathing and ability to breathe efficiently through your nose at night, which often is linked to the clenching of your jaw, which then causes things to break. So they would be the simple things: the sleeping, the clenching, their bite, have they got a difficult bite, and their general immune system, their whole body health. And are they supporting themselves? Are they keen to actually support themselves with nutrition, or just expect something to be put in the mouth and it work no matter what? And that's generally, titanium doesn't take those things, or it says everything can be coped with, and we'll just put titanium in your mouth and it should work. Obviously, placing titanium, there are some contraindications with them as well, with whole body health.
Well, yeah, the whole body health aspect is the key, and I think most people would be surprised the connection of oral health and whole body health. This is a whole new topic. I mean, we would need a complete different interview for that one, but that's really fascinating. Most people are not aware of.
Yeah, I mean, most people think of bleeding gums as just an inconvenience, really, but it's not something that's concerning them. Whereas if you look simply at the surface area of your gums is about the same surface as the palm of your hand. And if your hand was sore and bleeding all the time, when you touched it, you would expect the body to be reacting. You would expect it to make you sick if nothing was done about it. And it's just the concept of, that's just the initial thing. The gum health is really one of the first stages, and then those bacteria that are causing the problem can get into the system and affect heart health and affect lung health. I mean, the mouth is the top of the lungs. So we're talking at the moment with all this lung health and COVID, but the mouth is really the portal of the bacteria that can get into the lungs and get into the digestive system. It's the top of the digestive system as well. So it can only be connected to the rest of the body. It can't be compartmentalized into an area that doesn't affect the body.
Right, yeah. Perhaps one more question comes into my mind right now. That's the investment cost. I think for many people that plays a big role. Many base their decisions on can I afford it or not. What can you say for somebody who, again, is looking into this aspect?
Well, I think obviously there is quite a big investment when you're dealing with implant dentistry. There's a lot of training, a lot of special equipment that's needed for it. So it certainly isn't a cheap process. If you were to go down the route of having a bridge, which would involve damaging either teeth, say you had one space missing, then the cost of that bridge would be similar to the cost of one implant. So, so really, if the cost of a root canal treatment and a crown on a tooth can add up, especially if something goes wrong and then you have to have the tooth removed, the cost of that also will accumulate. So again, a similar cost for a ceramic implant. So the ceramic implants are around $3,500 per implant to place, and then they need to be restored with a crown, or sometimes with an abutment as well. So there are further costs involved. So again, there are companies placing titanium implants very cheaply, and it is possible to place a titanium implant anywhere, really. It's whether you want to have that or you want to take into account your biology, really, and invest in your health. So it is, again, it's not the economical solution. The economical solutions can be a little denture, but then that will attract more bacteria in your mouth and then lead to more risks of systemic health issues with the bacteria in your mouth having an effect on the body. So you have to weigh up really the investment you're prepared to make on your health, really. Hopefully that answers it.
Yeah, absolutely. And you know, this is a one, or can I say it's a one-off procedure? You have an implant for life, or?
Well, look, I wish we could say any dentistry can be for life. I don't think it's feasible to say that.
Okay.
The zirconia implants have been around for 19 years. So really, titanium implants have been around for 45 years, 45, 50 years. Yeah. But you couldn't say they are going to be there for life. But if, again, it relies on airway, your good sleeping, it relies on less stress, it relies on good immune system, good nutrition, good whole body health. They're the most important things when you're dealing with longevity in any dentistry, because then that takes away a lot of the stresses. And influencing what you put in your mouth as well, obviously, has an impact on, you know, if you're putting a lot of acids and foods that aren't good for you, then your body will first show the initial signs of inflammation, which often are in the mouth. Mm. So, and that compromises the longevity. So our aim is for you to have something in your mouth for a very long time and keep optimally reviewing things and making sure that all of those other aspects are taken into account.
Wow, great. I learned a lot. We will have some more topics in different interviews, but this shows again how important it is to see the body as a whole, to take so many different factors in account. So yeah, thank you, David, for sharing again. I appreciate really your way of educating. That's very unique in the marketplace, and I think that's very important and makes you unique as a holistic dentist.
Well, look, it's the only way really to talk to patients and explain, and as soon as everything's tied together so that, you know, their mouth is a reflection of their own general health. Yeah. But there are things that are clues that have gone on from when they were from when they were young children. Things have happened to them that have influenced the way their jaw comes together, which influences their airway, their breathing, their nervous system, their stress, and then that leads to more risks in dentistry. So, but I don't think there's any patient who I haven't clearly planned out and explained all of those things that they don't say, well, that makes perfect sense. And they understand. It just isn't, it's not really talked about.
Yes, yes. Great, well said. Thank you, David. And then, yeah, we talk for sure in some more interviews together about this very important topic. Yeah, again, thank you for being here. And
that's okay.
Yeah, thank you.